Inner South Community Health is an organisation which is committed to working with the local communities in the cities of Port Phillip and Stonnington. And what is important about our service is that we are linked to and intimately a part of our local communities.
I suppose I first heard about Inner South, would have been about 10 years ago now. Being homeless and needing help, I didn't know anywhere to go. I'd met this couple and they mentioned this lady Deb. They said, you know, how she was really good, she'd give you accommodation for a couple of weeks and she'd help get you on your feet. So I decided to hang around with them one day when she was coming so I could meet Deb, and she has been a gem, you know. I've done everything for my health through Inner South. I've got all my teeth fixed, my eyes fixed. They have clinics on a Friday just for women, so I come in and get all that sort of health looked after. No, I can only speak highly about Inner South, and it's not just me. I've seen so many people that have gone from really bad health to good health, you know.
We work with people that are homeless with complex needs, and we do assertive outreach. So that means we go out and look for people who are sleeping rough, down the park, along the beaches, in their own environments, and we assertively engage with the community members that are homeless.
I suppose I was first introduced to Inner South would have been the end of 1997, beginning of 98. I had some substance abuse issues and found myself more or less destitute and disenfranchised. I got to learn about the needle exchange, the different services, the dental service, the whole array, the whole variety of services. These services, though, they've saved my life. They really have. In conjunction. Not necessarily one person on their own, but the collaborative, City Port Phillip and St Kilda especially is quite good, and the services talk to one another, you know, work and talk together. So I think we're very lucky to be here. You know, this is an ideal place to try and recover. It's a bit like being out of rehab for the very, it's like, what am I doing today? Well, I don't have to do that.
Yeah.
From school.
You need a chance.
Yeah, and that's what this has given me, that time to not even think about it. In early recovery, in about 2001, Inner South had been a great support to me, and I decided that I'd like to give something back to the community. So I started doing a little bit of voluntary work with the City of Port Phillip Council. One thing led to another, and sometimes if I'm doing stuff with the City of Port Phillip, that's going hand in hand with some stuff that Inner South will do. So I'm a community consultant. So for general changes of programs or seeding of programs that they may be thinking of, I sit on the board. And I'm not altruistic, it makes me feel good. So I do get something out of it that, you know, when you're clean, well, at the end of your day, you go to bed and the positive thing is you were clean. But if you've been clean and you go out and you volunteer for the day, you go home and it's like, well, I've done something constructive with my hours today, so I'll sleep a bit easier tonight. So the voluntary work allows me to maintain my recovery and still practice work-like activities.
Good afternoon, Community Health and Rehab. This is Deanna.
One of the features that I think people enjoy most about Inner South Community Health is that we are fundamentally committed to preventing the community and individuals becoming unwell. And we put a lot of focus on working with vulnerable communities, and if they do become unwell, we will work with them in an integrated way. One of the ways we do that is that we have a real commitment to preparing care plans for individuals.
Hi Melly, how can I help you today?
I want to see Bob Ray.
1, 2, 3.
Thank you, Barbara. Thank you, Heather. And thank you for everybody look after me there in South Melbourne. I exercise, they look after me in the gym. Got trouble, my bill, that something happened, my fine, they help me. The doctor, I start from the wheelchair, then come to sticks. I exercise in South Melbourne till I left the stick. Now work slowly better, my life start better, slowly every day. They fix my teeth and my life, I can't forget them.
So, as a case manager, I work with people who frequently have complex issues. They've got a range of health and or social issues that they need assistance with. We work in a range of ways. It very much depends on each individual that we're working with and their needs, and referring on to other services that already exist to help them with their needs.
And that's what our clients love about Inner South. There really are no walls between the various disciplines that exist within our sites and where we are located.
Inner South Community Health gave me a life back. I was in a very, very unwell state. I was suicidal, totally isolated and totally depressed. And then I was introduced to Belinda. It did take a couple of meetings before I really could see that there was a trust relationship easily built. And from then on we worked very, very hard for about 2 years, nearly every week. And it was through Belinda's persistence and the non-judgment encountered when I was telling my story. The positive approach to you will recover. And from there we moved me to the anxiety group, Standing Up to Anxiety. Then I became the consumer rep on the staff steering committee for the mental health team's recovery project. And I became a member of interview panels. Because all along the way I'm learning about my value as a person, my confidence, about my mental illness, and moving slowly towards recovery and actually growing the acceptance that it was an option, and that option meant my life back.
Yes. I think Lee and I have known each other a long time now, that we have a good relationship.
You do.
You build that trust and rapport, and I think that's the foundations of any good relationship, especially a working relationship for a case manager, so you can gently challenge.
Exactly.
And then swiftly challenge.
Swiftly challenge when required.
When we need to.
Exactly.
And in your case, a number of times.
A number of times.
One of the other features of Inner South is that we don't wait for people just to come to us. We are committed to really what we call assertive outreach. We're interested in going to where communities need us to be.
And welcome to Rainbow Place. This is our fortnightly meal we put on for the community, and it's full of lovely staff and volunteers, and we get to interact with the mob here and over a great feed and meet beautiful people. So, cheers.
And so we're not comfortable sitting here and just waiting for people to come through the front door.
Mobile Health Service.
Yeah, hi sweetheart, how are you?
Good, how are you?
Not too bad. Are you able to visit now or is it too late?
Where are you?
I'm in,
I can't give you an exact time, but it'll be sort of within the next hour or so, I'd say.
Yeah, we're pretty busy tonight.
no, that's okay. No, what I've got is I've got a whole disposable thing kicked up, and I'd just like to collect some swabs and some water if you need water.
Do you want us to call when we're sort of heading in that region and see?
Oh, okay then, beautiful. All right, that'll be great.
No worries.
All right, well, thanks very much for that. You guys have a good night, okay?
Thanks, bye.
You too, see ya. Hi, how are you going?
Good, thank you. How are you?
Good. We're from the health service. Can we get you anything tonight?
Yeah, can I have some purple, blue and pink condoms?
No worries. Just a handful?
Yep.
Okay. Can we get you anything else? Any lube or anything?
No.
No, they're right just like that?
Just like that.
Okay, there you go. Take care.
Take care.
Do you have a good night?
You too.
Bye.
See ya.
And when those people do receive services, we'll then gently either administer the services that they need, and of course we'll do everything we can to ensure that they can access all the services that they need.
And we, at times pick up the pieces when we need to and intervene when we need to. But mostly we sort of stand back and support, provide that from a distance or sometimes a bit more closely, and yeah, there's not much we don't do.